My name is Lieutenant Commander Nakanti Adams of the United States Navy. I'm currently serving with the U.S. Marine Corps in Okinawa, Japan, and I'm an infectious disease physician.
I'm Andreas Clem. I'm a physician assistant with the U.S. Navy, currently stationed in Okinawa, Japan, working alongside the Marines with 3rd Medical Battalion.
Greetings, EVMS team from Okinawa, Japan. This is Lieutenant Junior Grade Tony Fryer. I am a proud Hampton Roads native and an even prouder EVMS MPH graduate.
As you know, we do have cases of coronavirus in Japan. The Japanese government has put in place a mechanism to identify cases early management, as well as a robust contact tracing program.
Regarding coronavirus here in Okinawa, Japan, what I'm seeing is sound order and discipline amongst our U.S. Navy personnel, which is a huge challenge given this time of uncertainty with frequent public health changes and policy updates.
Being an infectious diseases physician, my job essentially is to take CDC guidelines and translate it into policy that makes sense to protect our forces and beneficiaries in the area.
So as a physician assistant, I'm involved in direct patient care. I work in an outpatient clinic, so we've been doing a lot of standard precautions, wearing PPE and screening patients at the door to see which ones need to be put in isolation rooms, trying to stop the spread of this virus.
Now, from a Navy medical leadership and public health professional perspective, the measures I am taking in the wake of coronavirus, it's completely in the direction of information management, and that's dissemination of information to our personnel, but also the management of misinformation.
EVMS, as you know, is very focused on community service, and so during my time at EVMS, I was involved in a lot of community programs.
The faculty and staff were really impactful in my preparation while I was in the PA program at EVMS.
What EVMS has taught me, it's 100% transferable to the current situation here on Okinawa and across the world.
Actually was able to do a rotation with EVMS infectious disease, which was very useful to get to see all the infectious processes that we learned about kind of play out in a patient in an inpatient setting.
Their involvement, their engagement, and the cooperation for improvement in Hampton Roads is the #1 takeaway for me as I apply it here in Okinawa with 3rd Medical Battalion to my community of sailors and Marines, and not just the service members, but their families as well. Making sure during this time, as any time, that they have the information they need to stay safe, stay healthy, and to be able to continue to serve.
This is actually my second outbreak. I was involved in the West African Ebola outbreak in 2014. My background with being involved in community service and then the Ebola outbreak a few years ago, I think the combination of those two gives me a lot of insight into some of the planning that needs to happen to be able to properly respond and prepare for this outbreak.
Lastly, I'm very proud and encouraged to be working with 2 other fine naval officers from EVMS.
I think it's really living out EVMS's mission of community focus, world impact.
You take our 3 different specialties, MD, MPA, and MPH, and we're over here coordinating in uniform for a bigger picture, and that's to keep the warfighter in the fight, whether there's coronavirus or no coronavirus.
And so, of course, now that we find ourselves in a situation like this that's happening in the world, it'd be interesting to use what we learned from EVMS to assist in the preparedness and response.